Our patients come to us for help with all kinds of issues, but one of their leading causes of death is something that's not easily seen, and even harder for them to talk about. Suicide is one of the leading causes of death between the ages of 10 and 54, and it claims more lives than homicides. Most who commit suicide had visited a healthcare provider within a year before their death, usually with concerns of abdominal pain or headaches. Research shows that many patients who are struggling with suicidal thoughts are waiting to be asked about it. Oftentimes, they will not offer up this information voluntarily, but if asked directly, they will be more open to reveal their emotional state. And it's important that we're asking specifically about suicide, so these patients can get the referrals and resources that they need and deserve. Let's watch this conversation and see if you can identify what the RN does correctly and what they do wrong.
Okay, I just have to ask a few more questions, and I know this is really strange, but we have to ask these questions. You're not suicidal, are you?
Oh, no.
Okay. You haven't tried killing yourself, have you?
No.
Okay. In the past week, have you tried to hurt yourself at all?
No.
Okay. And the last one, and I'm sorry about this, but has anything stressful happened to you in the past few weeks?
No. No.
Okay. And I'm really sorry about that. We just have to ask those questions.
Okay.
Let's take a look back at that section.
You're not suicidal, are you?
Don't say, you don't feel like killing yourself, do you? That makes it sound like we just want them to say no. This is an example of leading the patient to an answer. We want patients to feel that we want to hear their answer, regardless of if it's positive or negative.
And the last one, and I'm sorry about this, but has anything stressful happened to you in the past few weeks?
Avoid being overly apologetic. Apologizing too much makes it sound like it's wrong to ask about suicide and wrong for them to admit to having those thoughts. We don't want the patients to feel ashamed if they say yes. Let's take a look at another interaction.
Hi, Sam. I'm Josie. I know you've been asked a lot of questions today, but we do have to ask a few more if that's okay.
Sure.
We like to ask everybody just to better treat the patient about their emotional health.
Okay.
First of all, are you here because you've tried to hurt yourself?
No.
Okay. In the past week, have you had any thoughts about hurting yourself?
No.
Okay. Have you ever tried to hurt yourself or kill yourself in the past?
No.
Okay. And my last question, has anything stressful happened to you in the past week that you would like to talk to us about?
No, I don't think so.
Okay. Well, thank you for your honest answers. We like to help everybody to get them better resources and just to help them with their emotional health and make sure that they have everything that they need.
Sure.
This is an example of good communication. Explaining the why helps the patient feel better. It shows that we care about the whole person and their emotional health as well as their medical health. Let's see another conversation.
Hi, Sam. I'm Josie. I know you've been asked a lot of questions today, but we do have to ask a few more if that's okay. They're related to your emotional health.
Okay.
First of all, are you feeling suicidal at all today at this time?
No, I'm not.
Okay. In the past week, have you had any thoughts about killing yourself at all?
No, I have not.
Okay. Have you ever tried to hurt yourself or kill yourself in the past? Okay. Okay, I do have one last question for you. In the past week or the past few weeks, has anything stressful happened to you that's been hard for you to handle?
Kinda. I lost my job recently, and I'm really worried about whether or not I'm going to find another one soon.
Okay, I'm so sorry about that. I know it's really hard to handle those situations. Do you want to talk about it a little bit more? Do you want to tell me a little bit more about how you're feeling?
I think I'm okay right now. Thanks.
Okay. I do want to let you know that when you're discharged, we can put a referral number onto your discharge paperwork. You can call them and they can get you some additional help if you need it, okay?
Oh, okay. That'd be great.
Good work. You found a sign that could mean they need help. Try to show empathy and communicate that you were sorry for what they're going through. We want the patient to know that we care about their emotional and physical health. The low intervention screen on this patient will automatically generate a crisis hotline number on their after visit summary. But try to care for the patient in the moment with encouragement and phrases like, "Would you like to talk more about this?" Or, "Would you like me to call pastoral care?" We want the patients to feel that they can talk to us about how they are feeling. Let's take a look at how this would apply when speaking to a parent of a patient.
Hi, Cheryl. I'm just going to ask a few more questions to your child. We ask everybody 10 and over about their emotional health, and it just helps us to better treat them and make them feel a little bit better about the questioning.
Oh, sure, that's fine.
This is another example of good communication. Explaining this helps the patient feel more comfortable instead of just asking questions with no explanation. And more importantly, it shows that we care about emotional health for patients of all ages. Please remember that most individuals who commit suicide have visited a healthcare provider 3 months to a year before death. The provider they are visiting might be you. What if you had the power with a few questions to identify that person struggling? What if you were able to get them help? Be the person that takes the time to ask the questions and ask them well. You may just save a life.